All right, we'll get started. Good morning, everyone. My name is Yvette Bragg, and I am the Chief of Stakeholder Relations and the Veterans Experience Officer from Columbia, South Carolina VA Medical Center. So today we will talk with you, the veterans here, about your health care. If you have any questions, make sure that you complete the forms. But before we get started, and one of you know about the restrooms and full support, they're through this door, to the right and to the left. Okay? So next thing we're going to start, we're going to do the Pledge of Allegiance. And Mr. Jim, he's a Florence Church Manager, and lead us into the Pledge of Allegiance. If you can stand.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You can have a seat, please. And normally we will start off with the medical center, but to go out of order just for the time being. But I'm going to introduce the panelists first. So I'm going to start to the first person here, Dr. McCallum, and he's our acting chief of staff. Next to him is Dr. Luster. She's the associate director for patient and nursing service. And next to her is our Superman. He's our acting director, Mrs. Jefferson. Next to him is our acting associate director, Bridget Charleston. Next to her is our assistant director, Marty Mack. And next to him is from Veterans Benefit Administration, Mrs. Sheila Jackson. Also in the audience, we have several staff members. You can stand up. There's a lot of them, so I don't want to miss anybody. If our staff member can stand up, please. But I do want to recognize Dr. Jeffro, and he's over the primary care. Dr. Hicks, she's co-CMO, Chief Medical Officer. Audrey Livingston, she's Associate Nurse Executive for Primary Care. And Sharon Bialy, he's Nurse Manager. And Rich Logan, he's our Administrative Officer. Everyone's met Jim. So, and like I said, we have information tables around the corner, from each one of them. And since we have a little bit of time before Ms. Jackson go forward, as a lead person from each table, would you stand up and say, what are you representing, please? First table, social worker.
Hi, I'm Shinny. I'm the Assistant Social Work Chief. I'm here for social work, and we also have Ms. Holly for Veteran Justice Outreach.
Okay, next to them in the business office.
Hi, I'm Pamela Austin. I'm the program manager over scheduling. And over here is Mr. Martin and Ms. Tucker, who's over travel.
Next to them is MUCC?
Hey, I'm Walter Harper, I'm the Chief of Community Care.
Okay, next, welcome Senator again.
Oh, my name is Mr. Collier, Chief of Patient Benefits. I'm over eligible enrollment.
We have the Fisher House in the back.
Hey.
Ms. Cameron Rhodes.
Chandler Rose, Fisher House.
Mental health.
Yeah, good morning. Chief of Mental Health here, Belton Kaufman, and Dr. Brian Apple, Program Manager over Suicide Prevention, and we do have some suicide prevention materials here if you are interested.
Okay, next to them is Post 911, the military VA.
Hello, my name is Sam Myers. I'm the transition patient advocate for the Post 911 Military VA Transition Program. We have our case managers, Ms. Michelle Braithwaite and Ms. Anne-Marie Weaver.
Okay, thank you. And at the front here, we have a patient advocate.
Natisha Adams, patient advocate, and we also have Ms. Breakaway, who is the patient advocate for the Florence Clinic.
So now it's my pleasure to introduce Ms. Jackson, and following Ms. Jackson will be our Superman, Mr. Suits.
Thank you very much. Let me see. I can't use my outside. So good morning. First, you have to be smarter than the apparatus. Listen, I just want to take a moment to thank you for coming out, and you see how vitally important it is for all of us to be accountable to you. The only reason that we come here, I am Sheila Jackson, as they said, I am your benefits regional director. That regional office is here to serve you, the community, and all of our state and local partners. And as you see, we partner to try to hear what it is that you have and your concerns. The only reason we do town halls is to listen. We want to hear you. So please present what your issues are. I have my staff here as well. If you have benefit questions or questions about your claim, we're here to answer those questions for you as well. But as an Army veteran, 20 years, the only concern that I really have when I see your faces and I'm out here with you is, how are we serving you? This is just a great opportunity. I don't know, after your service, if you really ever reflect on how you made this country strong by putting on that uniform. And now the nation and all of us are sitting here saying thank you, not with just words, but here we are. We're here to hear you. It is your turn. It is what you do. I am trying my best not to, be too exuberant and too excited, but I'm always excited when I get a chance to match my heart with your heart and with your concerns. So let us know exactly where you are now. A few things that are happening this fiscal year for us in the BBAs. We've heightened our interest in making sure that we streamline our processes. We know that bureaucracy-wise, it can get complex to you to even file a claim or to get information. And we're trying our best, listening to you, to streamline that, to make our processes a little more efficient. And this is what our secretary is constantly communicating to us. Let's make it easier, better for veterans. That's the only reason that we exist. So you help us do this when we come right to here, right to you, and hear what your concerns are and how what we're already doing is impacting you. The other thing that I'm very interested in for South Carolina veterans is making sure that you are fraud aware. In other words, filing for your benefits that you have so richly earned is free. It is to you without anybody telling you that you have to pay thousands of dollars to get what you already earned. And so I am going all around trying to get I have pamphlets here today, trying to let you understand what your rights and what your benefits are, but you've already earned them and you shouldn't have to pay for them. And our Congress says you don't have to pay for them. So those are the two things that I'm going all over the state, trying to educate you and let you understand that if you have issues, that's why this panel comes here and give you the time to try to tell you if there's an issue with our system and the way that we serve you, let us know, so that that's the only way that we can improve it. The last town hall that I was in, You told me when you go on CMP exams out into the community, sometimes the providers are not giving you the attention, or they're rushing you through. I took that information, escalated all the way through my chain, and they are addressing those issues with, okay, maybe we need some more oversight on the line. I'm just telling you that what you say here today and always matters. So just share what your concerns are. I'm excited to be out here and see my first time in Chesterfield. I'm very excited about being here. So listen, let's have a great town hall and hear what's on your heart, because this is all about you.
So thank you, Ms. Jackson. Thank you for truly dedicating yourself to veterans and their benefits. But more importantly, thank you for sharing across the state that there's some sharks out there taking advantage of veterans related to their disabilities. So thank you for helping us in that issue. So good morning. Thank you all for being here. I'm Jeff Suits, the Acting Medical Center Director. I'm a retired Air Force veteran, and I am here to serve you. This entire Columbia healthcare system has one objective, and that is to take care of veterans. That's the only reason we're here. That's the only reason our entire organization exists, is because of veterans. So we will do what it takes to give you the best care we can possibly give you. So every time we have a town hall, these are vitally important to us. We get to connect with you, we get to hear what you're experiencing, and we get to find ways to improve. So thank you for being here today. Thank you for giving us your time. And I do ask, if you have a very specific medical issue, please do not share that with the whole group. We will meet with you one-on-one to discuss your specific medical issue. But if you have holistically process issues, we definitely want to hear about those. I also want to bring up the brand new Florence CBOC clinic. I think most of you probably go to that clinic. I think that's the closest one from here to you. So that clinic opened in June of 2025. It's a little over 27,000 square feet. We're going to have an official ribbon cutting on April the 24th. But since we've opened that clinic, we have served 7,400 veterans in that clinic. Over 30,000 encounters came through that clinic. So we're very, very excited about all of the work that's going on in that clinic, and we're expanding that clinic as quickly as we can. But it's our true state-of-the-art facility that's got primary care, mental health, rehab, audiology, all kinds of services that we viewed that was needed in the Florence area. So hopefully that clinic will prove to be much better for you. The previous clinic was 9,900 square feet, and this one's 27,000. So what makes that clinic so nice? Yeah, it's a state-of-the-art facility, but it's the staff that is in that clinic. They own it, they are family, and you as a veteran are part of that family. It's truly remarkable to see the connection when we go to our CBOCs and the staff and how they relate to the veterans as family. So I hope you're taking the time to enjoy that facility, enjoy the staff, because it truly is a remarkable facility. But again, thank you for being here today. I'm going to pass it over to my colleagues so you can hear from them, and then we'll open it up for any questions that you may have for us. So next, I'll hand it over to our Acting Associate Director, Ms. Shawson.
Good morning. My name is Bridget Shawson, and as Mr. Suits said, I'm the Acting Associate Director. I have been in this role for 30 days, almost exactly. And so I appreciate your patience as I learn the things I don't know. I'll tell you what I do know. Mr. Suits stole my lines, first of all. So he already told you the information that I memorized, but that's okay. No, seriously, I've been to the Florence CBOC in the short time that I've been in this role, and it's a beautiful facility, 22,000 square feet. That was one of the things I memorized. So anyway, it's a beautiful facility, but that's not what's important. The way it was built and designed for you all to navigate your appointments easier. In addition to the services Mr. Suits mentioned, they also offer women's health, mental health, and you have on-site laboratory. So that's really important to provide you in your environment, in your home, access to these types of services. The other thing that he did mention that I'm going to address again is the staff there. When I was visiting a week ago, I got to meet the nurses, the providers, and the MSAs. And when I tell you that these people are dedicated to you all and to what they do to serve you, I'm not exaggerating. It was refreshing and just enlightening to see their passion for the veterans, for you all. And so I thank you all for your patience and for allowing me the opportunity to serve in a different capacity here with Columbia, to serve you all to the best of my ability, and I thank you again for your service.
Next, I'll hand it over to our chief nurse, Dr. Ruth Musker.
Good morning, everyone. This is my third trip to Chesterfield, actually. I had a great colleague that worked at the VA, Richard Rivers, who passed away actually in 2008. And that name is common in this area, so have really very fond memories of Richard, and actually still keep in touch with some of his family from the area. As mentioned, the Florence Clinic is one of our beautiful new facilities. As you've been introduced to Jim Thomas, who's a nurse manager. He's kind of the go-to person for most anything, and in addition to Dr. Hicks, who's a co-CMO there. So if you have any concerns, I know you met Jim, so we really keep in touch with all of our leaders in the CBOCs. We have a morning huddle every morning. We keep in touch, and actually with Florence and Rock Hill, since they are our two newest clinics, we've been having weekly huddles just to make sure that everything is as it should be, and to follow up with staffing. The staffing in the nursing realm at Florence is actually pretty good. We have one LPN vacancy, and we're recruiting for that LPN. And that announcement should close, I think, on the 2nd of April, so this week. So we're very fortunate to have really a pretty well-staffed clinic as far as that goes for our 70-some hundred veterans there. I did want to talk a little bit about, I have other staff here, community care, as mentioned, that group is under me, as well as the post 9/11 military to VA program. But I also wanted to introduce you to Sean Reale again, who's the lead nurse manager for the C-Box. He's actually helping out in our newest Rock Hill clinic. We staffed that in July, opened that in July, just about a month right after Florence. So he's been there actually very consistently to help get that clinic going and getting it in good shape. And then Audra Livingston, of course, is the associate nurse executive for primary care. And she keeps a tab on all of the activities of primary care throughout our healthcare system. I did want to mention about the clinical contact center. We used to call this the TAP line when we telephone advice program. About 3 years ago, we transitioned from that local call center to the clinical contact center, which is manned by nurses across our VISN. So they answer the phone for all of our medical centers. But it's really a great opportunity for you to, if you have a question, that clinical contact center is answering the phone for all of our primary care and CBOCs as well. So if you have a medical concern, you want to talk to a nurse, you want to talk to a scheduler, or you have a question about a pharmacy medication related question, those are the 3 Qs. And when you dial into that number, that's how you get in contact with them. And so we get feedback from them all the time. It's a continuous loop. But it is one way, and particularly if you call after hours and you have a concern, you can call that clinical contact center, talk to the nurse, and the nurse may offer you, they have providers in that clinical contact center that can do a video face-to-face appointment with you. So a lot of things can be handled without being actually seen face-to-face. So if you had a question and you had a concern and you wanted to see a provider, or you were triaged by the nurse and deemed appropriate for a video connect appointment, then that's the way to get it. The other thing is we have tele-emergency care. So actually we have emergency physicians that do tele-emergency care. So if you call into that RN line and you have a concern that's pretty urgent, they can get you also to be seen by a tele-emergency care person. So you don't have to get out of your house. You can call and be seen. And most of the time, those things can be handled without going to an emergency room or an urgent care somewhere. But if you needed to, they will send you in that direction. So it's a really great service. Not a lot of, seems like we're having trying to socialize that so that you can know that you can call that number and you can get help right away. So I wanted to make sure. And then also they do the schedulers do scheduling for our primary care clinics as well. So that's a really great number, and I can give that to you. if you so desire, it's 855-679-0214. And you should have that information when you have your primary care appointments at the Florence Clinic. And it should be on lots of websites as well. So you can, that's how you reach them 24 hours a day, 7 days a week. And that's pretty much it for me. I'll turn it over to Dr. McCallum.
So, thank you, Minister. It's truly an honor to be with you here today. Thank you for your service and sacrifice to this great nation, and thank you for allowing us to partner with you in our healthcare. We look forward to hearing your feedback and continuing to improve the care that you receive. So today just happens to be Doctor's Day, and I want to take a second to recognize our physicians enterprise-wide, but particularly at the Florence CBOC, and they are a highly skilled, compassionate, mission-driven team, and they're wonderful to work with. I also often find this day is actually also a time to reflect on why we as physicians became physicians and do what we do. And for me, it's very easy. I have the honor and opportunity to take care of the greatest patient population in the world, the veterans. It's an honor to provide you with care, and thank you for trusting us to provide it. So your voice matters, your feedback matters, and we look forward to hearing what you have to say today.
Okay, I'll turn it over to Mr. Ronnie Mack, our Assistant Director.
Thank you all. Good morning, and it's an absolute pleasure for me to be here with you today. My point today is to emphasize the background of what makes this team so special and what it means to you. So I'm talking from the people that clean up the facility, and you would agree that's an absolutely beautiful facility. People that take your lab work, just people that schedule your appointments, absolute stellar team. They're specially trained to customer service to make sure they can take care of you. But more importantly, when you find something that may be a little off, that's why I need you. I need you to be able to just reach out to someone and tell us what's going on. Without your voice, your eyes, we can't get better. I know there are issues sometimes for whatever reason. Don't just go leave the facility with those issues. Talk to us, and we will do everything that we can to take care of you. That's from the person sitting at the front desk, to your nurse, to the cleaning person walking through the building. They will stop and grab someone to take care of you. So I want to emphasize that. Please do not leave the facility if you're not thinking that we are the best facility that you receive healthcare. Any questions about that? And that's from a 21-year Air Force veteran. So I'm here for you. You're part of the team. You're part of the family. Any questions? One more thing. When we give you a survey to fill out, that's another way to feed us information. So if you have any questions, if we did something great for you, if we took care of you, please tell us, let us know. Okay? All right, thank you.
Okay, Ms. Gregg, I'll turn it back to you.
Okay, we're ready for a question and answer session. The first question is for travel.
You're gonna love the response, I'm sure.
So Mr. Williams, he's the Assistant Chief of Business Office. The question is, why does the kiosk machine stop being used to request travel pay and via development?
Hey, so good afternoon, everyone. Can you hear me? So I'm William Stinney. I'm the Assistant Chief of the Business Office at the Columbia VA Healthcare System. Amazing question about travel. So what we wound up doing was we converted travel to this system called BTSSS. What we did notice is each veteran still has an opportunity to do a paper claim. So we hired a new mobility manager, please stand up, Mr. Martin. So Mr. Martin is an Army veteran as well, and we've been grappling with this idea about putting that onto the kiosk. But during our VTP process, Veteran Transportation Program, we do things differently in different areas. Some facilities still have the kiosk on it with travel claims. So we're wrestling with that process to put it back on, but I did bring the team up here so we can work with you individually to show you how to utilize your phone to look up two things. You're going to be able to see your VA appointments. You're also going to be able to file travel on your phone. And you still have the opportunity, if you don't want to do that, to do paper. But we are considering, since we are expanding our CDOCs, to put the actual travel process back onto the kiosk. We'll work with our leadership, at home, and then we'll do what we need to do to service you. The other thing we forgot to do, which is my fault, and I'm sorry about that, Mr. Kelly, stand up. So our Healthy Vet Coordinator is standing right here. We're gonna attempt to do several things, and we're gonna accomplish this because we're hard workers. We're gonna attempt a one-on-one with you today. If you have a question about My Healthy Vet, and we'll one-on-one with you with travel. Ms. Tucker, stand up. Ms. Tucker runs your travel plan. Some of y'all probably already talked to her. She does all of the processes when it comes to travel. So we're here to serve you. We're here to be right by you. So just stand back, just come get with us after this, and we'll be happy to help.
Oh, don't sit down yet, we got another part to it. Sure. The question is about the My Healthy Vet online, why it's so difficult getting that money.
Great question. So I use My Healthy Vet every single day when I order medication or I have questions from my provider. You want to know why it's so difficult? It's difficult. We have Mr. Collier, who's taken another position, showed us different ways how to make it easier, to streamline it. The bottom line is it's for security. So it's an authentication process. It's the same thing that you do when you apply for positions. It's the same thing that you do when you use these security programs. We're trying to protect your security and your privacy. But what we'll do is show you easy ways to do it if you have questions. That's why the whole team is up here so we can help you. Thanks, everybody.
All right, our next question is for community care. Mr. Walter Harper, who's the Chief of Community Care. And your question is, why isn't community care more efficient?
So, morning, everyone. My name is Walter Harper. I'm the Chief of Community Care. Community care has seen a growth in our PA system, our catchment area, in the last 2 years. Originally, we were staffed for about 68,000, and last year we did double that. And so this year we're predicted to grow by about 20%. So we're going to be between 150 and 160,000. And so what that means is our hiring hasn't grown fast enough to keep up with the volume. We've done a couple things to address that. We've had in the last 2 months, we've scheduled 21,000 appointments, and we are hiring 34 new staff. And they're in various parts of recruitment, so they're really coming on board to start to see some improvements in time frames. What we want to do is make sure that we contact you, we get the information to where you want to go, we send that information to the vendor, and they can make contact with you, or you can make contact with them to schedule. If you're receiving a letter in the mail and it says the vendor that you're going to, the provider's office, you can contact them to make that appointment. And one of the things we need your help on is when you do get an appointment from them. Okay, so I'm just going to try to be loud. Okay, so one of the things we need your help on is getting that appointment information back from you. So if you contact them and you schedule your appointment independently, there's a ways you can do that. You can call us at the 6856 number, or you can send us a secure message that you're scheduled. And if you have any questions, we get about 50 to 60 secure messages. We turn those around within 2 days. So if you have questions, that's another way to get us. We answer our phones pretty regularly. So sometimes the phone calls yeah, we're
We're calling to schedule you right now.
All right, this is our last written questions, and then we'll go into the audience question. And I'm not sure whether it's maybe VBA or not. Are you going to have another meeting concerning wills, trust, ETC, etc.?
Good morning, everyone. As you can see, I'm not Ms. Jackson, and I'll do the best I can. My name is Marlon Hines. I'm the Public Affairs Officer for the Regional Office. we'll get with our partners who normally host that. I will tell you that the PD, CVEB, our president is here, and they do a lot of coordination with those specific kind of events. Typically, VBA is invited to those. We don't necessarily host them, but I will talk to her. Tasha, can you stand up, please? And so she's the president of the CVEB that handles the PD. They meet the fourth Tuesday at 10 a.m. down at the Florence County VSO office. And so I will get with her, and once we figure out something, we'll share that information.
I believe that that question pertained to an event that we, the veterans here in Chesterfield, hosted 2 years ago. And I'm pretty sure that's what it is. We did not do one the last year because we were advised by the people coordinating us to not do it in less than 2 years. And so you all were not the ones who had the legal clinic, we did. And we did do it here in this building. So I don't know who the question came from.
Yeah, the name wasn't on here, so.
Yeah, but we were the ones who did it ourselves here in Chesterfield County.
Thank you for clarifying that.
Yes, ma'am.
All right, before we go to questions from the audience, Ms. Mills, can you please stand up, please? Ms. Mills was the person that organized this for us to have this location, and we just want to take this moment to tell you thank you. And Crystal. So, first question, anyone out in the audience?
Yes, he does have a question. It has to do with transportation on that what is it, the bus system that runs from Chesterfield over to Florence and other places. And that's what this issue has been, trying to get connected with that, to be able to have, this is one of my World War II veterans. So we have
First and foremost, as a World War II veteran, I'm so proud of you. My uncle turns 100. He was on the USS Washington. May 2nd is his birthday. He'll be 100, so thank you. So what we're going to do is, after this, we're going to work with him one-on-one because we have other opportunities to transport. So we can transfer via Uber. We can transfer with Mr. Martin's program, the Veterans Transportation Program, where we can send somebody to pick him up. Right. And because he can ambulate, that means because he can walk, we want to do as much as we can for him to get him to his appointment. So we're going to work with you one-on-one.
Thank you,
You're going to see Mr. Martin, and we'll make sure that we handle your next travels for your next appointments.
Thank you, because he had been told that he had to do that 25 miles.
I'll
We
take
know
care
that's
of it.
not true.
Yes, ma'am, you got it. That's why Mr. Martin's here. So we're going to work out a process where we crawl, walk, and run. We're going to make sure you're comfortable on how we transport you. If the Uber is a process that's easy for you, we'll get you on an Uber to get you back and forth. If we can't do that, he'll send another vehicle up there and we'll just make sure we make it work. What we're trying to do for Rock Hill and Florence is hire new FTEs. We're going to station a vehicle out there, that's his idea, and then we'll start transporting more easily for our veterans. But it takes time to get them more vehicles. He's working on that. It's going to take us more time to get 2 more FTEs. We've got one coming in thanks to our leadership, and then we'll have another one, and then we can start deploying the vehicles. But we got him covered. Don't worry.
Okay, and his wife, his daughter does not drive.
And
So-
guess what? She's part of the family too. We'll take care of her.
Thank you so much, sir.
Just want to recognize our World War II veteran. His name is Mr. Charlie Till. So if anyone will stand up and. Mr. Till, real honored. All right, is there any other questions in the audience? Anyone would like to? Okay, back to you, Mr. Sims.
So again, I want to thank you for your service. Thank you for your trust. We will stop the rotation of the earth for a veteran. That is my charge to you. Every single day, we are here because of it. So thank you again for being here today. Thank you for trusting us, and thank you for everything you do for our country. Have a good day.